Hi, good morning everyone. Good morning Dr. Mashitah. Good morning Dr. Fairuz. So my topic today is animal bites and sting. First we talk about animal bites, well, including dog bite, cat bite, monkey bites and other wild animal bites. So usually the main principle of cares of the treatment is medical approach, wound treatments, closure of the wounds, prophylactic antibiotic, proceed with rabies vaccines and ATT. So usually we divided the dog bite or animal bites to three categories. The first is cat 1. If the history say that it's just leaking over the intact skins, licked by the animal, touched by the animal. If it's a reliable history, we just reassure the patients no action will be needed. But if the history is non-reliable, then you can treat as cat 2. Cat 2 will be superficial scratch, any nibbling or leaking of uncovered skin. We'll need to proceed with wound treatments and vaccinations for rabies vaccine. Cat 3 will be bites that penetrate deep into the structures or multiple leaks over the mucous membrane, multiple bites or any wild animal bites. We'll need wound treatment, rabies vaccine, rabies immunoglobulin, antibiotic, and ATT. So if there's a animal wound bite, immediately proceed with wound irrigations. Make sure you irrigate the wounds with copious water, can use soap or detergents, and if available, can use povidone iodine. After the irrigations and removal of foreign body, can consider to suture the wound. Most of the dog bites can be sutured unless if it's an injury that damage into the deep structures. You can see the muscle or the tendon, or it's a punctured wound. Cat bite or human bite, bites over hands or feet, or wounds over immunocompromised patients, or wounds that's more than 12 hours. The wound closure can improve the cosmetic outcome but actually increase the risk of infection. Next, you can consider give the patients antibiotic, preferable augmentin. If not available, can consider doxycycline or clindamycin. If it's a severe wound, can give IV Unasil or IV tazocin. The duration-wise, if prophylactic, you give 5 days. If it's infected looking, you can give 10 days. So rabies vaccines, you give to patients after the dog bite, usually needs 4 doses. For patients that previously unvaccinated, you give 4 doses, which is immediately day 3, day 7, and day 14. For a previously vaccinated, only 2 doses, which is immediately and day 3. For immunocompromised patients, you need 5 doses, which is another one on day 28. So next is human rabies immunoglobulin. This can provide the immediate antibody and protections to the patients, indicated in all cat 3 wound or immunocompromised patients. Only needed to give once and always give with the first dose of rabies vaccines. If it's not available, can be delayed up to 7 days from the first dose of vaccines. But if it's already more than 7 days after the rabies vaccines, then no need to give anymore. The doses for all age group is same, is 20 unit per kg. So for the injections, you need to give it directly into the wound, inside the wound, and then around the wound. If still have remaining, inject it at intramuscularly at the site that's far away from the site that you give rabies vaccine. So human rabies is a viral infection that's caused by Lissa virus genus, usually affect from animals spread to humans by bites or scratch, caused by domestic or wild animals. It mainly attack the central nervous systems. And if a patient came in to you presented with a full-blown like rabies usually is very high mortality rate. The incubation period is can be less than 1 week or more than 1 year, average between 1 to 3 months. Initially, we were presented with fever, pain, tingling, pricking, or burning sensations at the bite site. There's 2 types of rabies. The first is the furious type. Patients who came in presented with abnormal excited behavior, hyperactivity, scared of water, scared of flying, then slowly proceed with go to cardiorespiratory arrest. The other type is paralytic type, which oftenly misdiagnosed. Patients will slowly feel paralyzed at the site of bite, and then the paralyzed will slowly progress. Slowly patients into coma, then respiratory arrest, and then death. So all the cases of animal bites need to be notified to the PKD within 24 hours. Ideally, they will work with the veterinary office. They will try to find the animals. If possible to find, they will quarantine the animals and then observe for signs or symptoms of rabies of the animals. For lab test wise, there's no test available before patients presented to you with rabies symptoms, and there's no single test sufficient to diagnose the rabies. You can send skin biopsy, cornea scraping, CFS serums, or if postmortem, brain biopsy. Lab can detect the viral RNA from the specimen. So if a patient presented to you with acute dog bite, first assess the patients clinically, get the vital signs, any sign of symptoms of rabies, then proceed with wound care and cover with antibiotic if it's a dirty wound. If Cat 1, KK can discharge the patients, but if Cat 2 or Cat 3 need to refer to the hospital. In the secondary setting, Cat 2 or Cat 3 can start the rabies vaccine immediately. And then if it's asymptomatic patients, can discharge with home alerts and rabies vaccination cert, which give the patients the date that they need to come for the following vaccinations. And if symptomatic, start the patient's vaccines and then immunoglobulin immediately and admit in ward for observations. So if a patient come to you presented with an old dog bite, if there is no wound, just discharge the patients. If there is a wound, proceed with wound care. If it's bitten within 3 months, you can give the patients. You can start the patient's vaccine if the status is unknown. The dog status is unknown, unvaccinated, or the dog or the animal was died within 10 to 14 days of quarantine. If it's bitten more than 3 months, you can just discharge the patients with reassurance. Next is insect stings. Usually happens to wasp sting, bees, or ant sting. It will cause local reactions, pain, redness, swelling, or sometimes will cause remnants inside the body, such as stingles, tentacles. Usually will cause systemic reactions like allergic reactions to patients, such as difficulty breathing, hoarseness of voice, nausea and vomiting, itchiness. Then the management-wise, you remove the stinger, put on ice pack on the affected area, elevate the area, give the patients analgesics, give ATT prophylaxis, and see if patients have signs or symptoms of anaphylaxis, any confusions, headache, any cough, difficulty breathing, wheezing, difficulty swallowing, any itchiness of skin, any urticaria, or patients if it's in shock. If it's anaphylactic reactions, then you proceed with the A, B, C, D, E for anaphylactic reactions. Yeah, I'll just skip through this. So last is jellyfish stings. There are cases of jellyfish stings in the, it's less common here, but we still see it in seaside like Langkawi or Penang. Malaysia does has a few very poison jellyfish, such as box jellyfish that see in Penang, Portuguese man of war see in Terengganu. They are all very pretty looking by the seaside. Do not touch them. If it's a jellyfish sting, it will cause burning, pricking, stingy pain, and it will cause a very typical jellyfish sting mark track, like a red, brown, purplish track on the skin. It will cause local itchy or swelling to the skin. Those that very poisonous will cause some systemic reactions, stomach pain, nausea, vomiting, headache, drowsy, confusions, some even difficulty breathing, cardiac arrest. So for the management, immediately rinse the site with vinegar and carefully remove the tentacles. Apply cold pack and then supportive treatments, case by case, depends what the patient's presented. So in certain country, their Pusat Racun Negara have the anti-venoms available, but I think not our country. So remember, do not rub on the site, do not pour urine on the site. Just provide analgesics and then supportive managements. That's all my slides. Thank you.
Okay, thank you so much, Jiale. Thank you for the comprehensive, for a good presentation. Okay, basically kalau yang sting ni tak banyak kan yang datang kita, especially yang Jiale cakap pasal apa tu, jellyfish sting. We seldomly encounter jellyfish sting sebab dekat Kedah ni tak ada banyak sangat. Tapi the one yang available yang banyak yang jellyfish so-called cases, kalau you being posted to Langkawi after this, Langkawi memang hari-hari ada case of jellyfish sting. Okay, even kalau you go and read the apa, baca apa tu, tak banyak nak makan ni. Baca apa tu, literature ke apa, the most, bukan the most lah, the recommended apa tu, treatment for jellyfish kalau immediate acute management is kalau ada apa tu, pernah dengar? Ada cuka. Okay? Cuka English apa?
Vinegar.
Vinegar. Okay. Vinegar. So the one yang kita dekat Langkawi pun kan, memang dekat emergency department ni memang ada vinegar. So kalau ada manage apa tu, jellyfish sting cases, memang dia bagi vinegar lah. Even kalau dekat, you all pernah dengar kan yang lima Langkawi Lima Langkawi bukan lima. Iron Man. Iron Man Langkawi, right? So kita emergency department, we do send our team as a standby team for all this Iron Man punya rally tu kan. Yang start dia ada apa tu, water event, dia ada kayu basikal tu. So after the water punya event tu, most of the time dekat jellyfish, dekat Langkawi tu, before the event itself, dia ada team yang akan go and catch all this jellyfish dekat event site tu. Dia akan go and catch all this jellyfish, and then masa dekat event tu memang kita ada team medical standby, and then immediately after they finish dia apa tu, swimming part dekat event tu, dia memang ada satu tempat tu, satu beja tu is penuh dengan all this vinegar. So kalau yang memang kena, memang akan kena lah. Tinggal teruk tak teruk je. Okay, so they will take the vinegar, guna botol kicap tu kan, yang boleh picit-picit tu kan. They will pour the vinegar dekat badan mereka sendiri lah. The one yang very severe one, we will bring to the medical base for continuous management. Okay, so that is jellyfish sting. So jangan kata, so we do have cases dekat dulu kita tak tahu. Ingat kan jelly box sting ni dekat Thailand, dekat ni, tapi we do have recent cases dekat Penang. So dekat Penang tu memang ada case of jelly box stings. So we do have most of the time kalau required suspected jelly box fish sting tu, sebab dia ada typical, apa tak ingat lah nama the typical jellyfish sting marks tu, the one you show just now tu kan, yang macam yang kena yang berselirat tu. So kalau you suspect the patient is actually been sting by jelly box, so we do consult kita punya Rex team, so they will mobilize the antivenom Okay. So apart from the most important thing is yang kita memang encounter every day, almost every day kan, you punya apa tu? You punya dog bite. Okay, dog bite. So dog bite ni actually, even though we don't have reported human rabies in Kedah State, but still since 2015 where we do have this animal rabies, okay, started from Perlis, lepas tu turun ke bawah ke Kedah ni. So since then we don't actually been declared safe of the yang so called this rabies belt tu. Kita tak di-declare lagi keluar daripada rabies belt. We still give vaccine to all our so-called category 2 and above dog bite cases. Category 1 memang patient tak datang pun kan dekat apa ni, dekat hospital sebab dia been leaking semua tu lah. So since 2015 tu till now memang kita ada buat audit regarding dog bite cases because the vaccine is very expensive. Vaccine is very expensive. Others state macam Penang, Perlis, dia pada stop dah giving this vaccine in grade 2 and grade 3 cases. Tapi kita Kedah HSAH kalau compare to HSB, HSAH and Kulim, HSAH we do have a lot of cases compared to this the two hospital. So kalau tengok audit from 2015 to 2019, the compliance of the patients who came to our emergency department to continue their vaccine rabies is more than 95%. Very good compliance. Semua takut mati kan, semua takut nak dapat rabies. That's why there's no reported human rabies in Kedah State. So as you all know, vaccine we give at 0 days, at the 3rd day, 7 and 14. Okay, that's why you have to report to PKD within 24 hours so they can activate the veteriner to go and actually monitor the dog. Okay, dia tak tangkap tu. Dulu yang banyak kita tak been reported. Tu sebab dia takut kita tangkap anjing tu so dia dilemkam. So within 10 days, if the dog is okay, there's no sign, there's no sign of rabies in that dog, so they will inform us to actually stop to inform that the dog is okay, bukanlah petunjuk mengatakan dog tu ada rabies. So we can stop the 4th dose lah. 14 dose tu kita boleh escape. So kita bagi 3 dosis saja. So but during the initial starting of giving all this vaccine tu, there's no such thing lah. Tak ada pun kata veteriner informed hospital that the dog is okay. Kan very quite susah lah. So most of the patient we complete until up to 4th vaccine. Lately lah, just started from last year. So we only, because of our audit, there's no reported human vaccine, human rabies. So kita stop until 3rd dosage saja. Okay, so regarding immunoglobulin, because the satu Malaysia ni tak ada immunoglobulin rabies so you give to all cases yang grade 3 kan, grade 3 where there is a breach of skin kan. So I understand. So something else I can help with. Lepas tu you tak bagi. So at the moment, because of there's no stock of immunoglobulin, so you don't give immunoglobulin to all patients. Tapi kalau ikut flow of rabies punya flow dekat Kedah ni, you still have to consult your ID physician because ada 1 or 2 cases yang very bad wound kan, sampai expose you punya muscle, expose you punya bone. So that one the immunoglobulin is recommended, so they will find the immunoglobulin dekat satu Malaysia ni lah. Okay, kita most of the time kadang-kadang kat Losnak tu ada je, tapi tak guna lah kan. Tapi bukan tak guna sebab apa, most of the time yang grade 3 tu simple je kan, memang ada breach tapi simple wound saja. Okay, So, Jiale, yesterday you just asked me, right, regarding should we give immunoglobulin in patient who already have this CNS symptom, rabies kan? Yang macam tu, vaksin saja you tak bagi you don't give vaccine. Okay, you can give immunoglobulin. Okay, that's why vaccine, if you give vaccine, is actually it up to 7 days. Then vaccine will be so-called vaccine induced humoral response will be so your humoral response will be activated after 7 days. That's why you bagi you punya immunoglobulin within 7 days sahaja. Okay, because at that time you punya vaksin dah berkesan. So in patient yang memang dah ada yang vaksin tu you bagi tu is actually to prevent the CNS infiltration of the virus. Okay, that's why macam yang patient yang memang dah kena rabies tu you don't give any more the vaccine, you only give the immunoglobulin sahaja. Okay, others regarding yang insect bite tu, kalau patient yang kena bee sting kan, so you have to make sure dia punya stinger tu is been removed Okay, kadang-kadang patient datang dengan apa tu anaphylactic you already given everything but buka baju the stinger is memang ada lagi, so you have to remove the stinger. Okay, kalau you go and read tu dia kata the best is the recommended yang selalu orang guna tu, you guna you punya credit card tu to remove the stinger, ataupun you tick satu-satu lah. Kalau satu-satu, kalau ada 100 stinger, kalau 100 bees yang kena tu nak tarik satu-satu tu ambil masa lah kan. Okay, so others is wound management is very important. Another part is wound management is very important. Okay, wound management, you punya irrigation, okay, you punya, and then kalau memang very bad wound kalau macam you kata animal bite, very bad wound kan, memang dah the principle is you don't suture immediately kan, you don't suture, so you actually left it open, you go and so buat apa tu daily dressing, cover dengan antibiotik. Okay, but if the wound is so big, takkan you nak suruh pergi buat daily dressing hari-hari kan. So you actually can approximate the wound, tapi jangan macam memang tutup terus tu. You have to just nak approximate, jangan bagi tutup terus, macam rapatkan sahaja. So patient can go to for dressing and then for wound inspection. Okay, kalau you go back and read ada books tu, dia kata kalau macam especially kalau laceration dekat muka kan, kalau dekat muka tu ataupun dekat especially dekat muka tu, you have to jahit lah. Okay, sebab apa? Untuk cosmetic value. Okay, so kalau kat muka tu you irrigate the wound properly and then you can close it. Okay, okay. Okay, any question? Okay, siapa pernah tanya tak?
Tuan Mashitah.
Nak tanya apa? Siapa tu?
Hello.
Alif. Okay.
Pasal jellyfish tu.
Jellyfish.
Apa ni? Saya ada dengar ada orang kata once dah kena jellyfish bite tu boleh irrigate dengan coke. Coke tu boleh ganti vinegar.
Coca-Cola
boleh ganti vinegar ke?
Supportive evidence yang kami dah. Coke.
Rumus.
Tak dengar. Tapi ada kalau you all dengar bukan, saya dulu dengar lagi worse. Suruh kencing pun datang tu. Aku terlupa cara ni. Pernah dengar tak? Pernah? Guna urin. Tapi tapi kan yang the most saya pun tak boleh nak ni sebab saya tak pernah dengar. Coke tu saya tak pernah dengar lah. Saya ni sebab apa yang vinegar tu saya tak konten dia saya tak tahu lah konten kok ada. Hangpa senang study evidence tak tahu lah, evidence based saya tak tahu. Tapi vinegar tu cuba cari balik tengok sama tak Coke, ada ke Coke yang tapi yang memang yang evidence based tu kita guna tu lah. vinegar tu. Coca-Cola. Wine. Tak apa, nanti saya balik baca sikit lah. Nah, pasal Coke tu. Nak habang pun sekejap lagi. Tak ada, kena study dulu. Nah, boleh Alif?
Boleh Doktor. Thank you.
Tadi ni kita tak tahu valid tak valid kan. So, kalau Google nak kena betul-betul tengok valid tak valid macam ni.
Okay, any question? Tak ada. Oh, satu lagi saya nak pesan esok-esok ni kan you all dapat pergi kat distrik kan. For example distrik dekat-dekat sini yang pasal you punya apa tu antivenom antivenom. Kalau you all dah bagi monovalent dekat sana kan, tiba-tiba kan within first 10 minutes tu you kena observe patients sebab you bagi slow infusion right within 10 minutes tu kan. Slow infusion you have to look for any evidence of you have to look for is there any allergic reaction, anaphylaxis reaction kan. So if there is no allergic or anaphylactic reaction, you actually can continue. To complete the infusion of the antivenom 45 minutes to 1 hour. Okay. So kalau dalam masa 10 minit terawal tu, okay, ada allergic, patient develop urticaria, okay, up to sampai patient develop hypotensive, okay. So you have to stop the antivenom, then treat the allergic or anaphylaxis up to the point you kena bagi sampai bagi IM adrenaline, okay? Sampai bagi IM adrenaline. After you treat the allergic or anaphylaxis, patient the so-called this allergic resolve kan, allergic resolve, hemodynamic stable. You still have to continue the antivenom. Okay, it is considered as antidote kan. So kalau you dekat distrik, most of the time MO akan consult dengan tertiary site ni. Okay, kalau macam you dekat Yan, dekat SIG tu dia akan call HSAH. So most of the time kita akan send over lah. So jangan buang that antivenom Jangan buang antivenom tu sebab kita akan gunakan antivenom yang sama juga bila sampai dekat sini. Okay, cuma dia punya infusion time tu akan longer. Despite you bagi sejam, 45 minit sejam kan, kita akan bagi more than that lah. 2 jam. Okay, saya pernah bagi 2 jam, 3 jam Provided patient is includes monitoring. Sebab apa? Antivenom tu mahal Satu vial tu kalau yang monovalent tu 450, 500 So kalau yang paling mahal sekali yang C-Snake satu vial ialah 17,000. So kalau at one go you bagi 1 hingga 3 vial kan, you darab lah kalau bagi 3 vial kali 17,000 tu. Lepas tu patient develop allergic reaction, buang pula tu. Sama juga you punya yang monovalent yang lain kan, 500 kalau 4 vial 2,000. Okay, so don't throw so you send over the patient with the antivenom tu sekali. Okay, thank you so much. Okay, bye-bye.
Thank you, Doktor.
Okay, ada apa-apa lagi soalan tak? Alif nanti balik baca sama nanti saya tanya kat Alif. Signifikan dia tu. Saya pun nak balik baca.
Balik SCD.
Okay
Okay, thank you, Doktor.
Okay, bye-bye.
Yang mild SCD macam vinegar, dia akan